This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
The problem that's happening and why this is a growing issue is because women's immune systems are altered and the vaginal microbiome is altered.
What do you think about cesarean sections then?
Well, the incidence of C-sections is just enormous. We've never had levels like we have now.
Why do you think so many people are anxious and not sleeping well?
Because everyone has circadian rhythm dysfunction.
Why are women at more risk of disease?
This is one of the terrible things. Up until 2015, the NIH made no requirement to distinguish who the subjects of a study were, whether they were male or female. And what I can tell you is they were always male.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Expert Series, where you'll meet 25 of the world leaders in health and wellness, discussing their passions and what it takes to make your shift.
There's an electrical feeling in the room.
I had to be a mom. It was so important to me.
I've always been a pain in the butt, and I love that.
I knew that I wanted to help people.
I'm Katherine Maslen, and this is The Shift. Hi, I'm Katherine Maslen, naturopath, author and host of The Shift. In the Expert Series, we share the insights, stories and expertise of each of our amazing experts. You might have met them on season 1 of The Shift, where we took snippets of these conversations and put them together into the series. If you haven't listened to season 1 yet, I'd recommend going back and listening to episode 1 on what it takes to make a shift in your gut health. We'll provide a link in the show notes. In this episode, we have Dr. Felice Gersh, an integrative gynecologist, author and speaker. Dr. Felice has been a board-certified obstetrician and gynecologist for over 20 years. She's worked with countless women, helping them through pregnancy, birth, and with reproductive issues like PCOS, endometriosis and thrush. She is the author of the book PCOS SOS and a leader in her field, speaking internationally on all things women's health. Dr. Felice is the director of the Integrative Medical Group of Irvine, which focuses on understanding women's innate physical and emotional makeup. She's been awarded the Orange County Medical Association's Physician of the Year Award for the last 13 years consecutively, and Southern California's Super Doctor Award for the last several years too. Women's health and fertility has always been a specialist area of mine, so I was very excited to see what Felice had to say on a variety of topics. As I said, Dr. Felice is a rarity, and this was the first time I got to talk to a gynecologist that worked from a holistic standpoint. Listen out for some interesting information about the vaginal and penile microbiome, the effect of birth control on cancer risk, your microbiome during pregnancy, and how the way we birth affects the health of our babies for years to come. Without further delay, let me introduce you to Dr. Felice Gersh.
I am Dr. Felice Gersh, and I am something of a rarity. I am an integrative OBGYN. So I take care of the entire woman, and I understand that reproductive health and global health of a woman are one.
Tell me, where were you born and where did you grow up?
Well, I was born in Brooklyn, New York, and my mom was very ahead of the pack. She was one of the earliest women lawyers, and she used a woman obstetrician. And there were so few, but somehow she found a woman obstetrician that delivered me in Brooklyn. And then I grew up for the first 3 years in Queens, so that's one of the boroughs of New York City. And then when I was 3, I moved into the suburbs to a city called Great Neck, which is on Long Island in New York.
Yeah. And when did you know that you wanted to be a doctor?
Pretty early on. In a way, this is good. My parents raised me with a very small menu of options. You know how you go to a restaurant and there are sometimes pages and pages of choices of things you can order, and so you just can't make a decision. There's too much. Well, I was raised that you have 3 choices. And I took that on their word, like, okay, I have 3 choices. I could be a lawyer, a teacher, or a doctor. those are my 3 choices. They said they serve people, and that's what you should be, you know? So it's like, okay, lawyer, nah, that's adversarial. Teacher, well, I like being a teacher, but I could still do that when I'm a doctor. And doctor, you know, I can save lives. I could do something really dramatic. So I became a doctor educator. So for my whole career, I've done a lot of education as well as being a doctor.
When did you know you wanted to specialise in gynecology and obstetrics?
Also pretty early on, I have PCOS. But of course I wasn't diagnosed. I say of course because many women with PCOS are not diagnosed, and this goes back a lot of years. I ultimately diagnosed myself, but I knew something was wrong. I had irregular cycles. I went 2 years without a single period. And I always had acne, which drove me crazy, and I didn't know what to do. I didn't understand it, so I would scrub my face with alcohol. So then I had all these pimples, and my skin was cracking. It was so uncomfortable and terrible. And, I just hated it. And so I went to one of the very top of the heap GYN people, specialists at my medical school. And I said, something is wrong. I haven't had a period in 2 years. And he said, what are you complaining about? Women hate having periods. What's your problem? Just go on birth control pills anyway. And it's like, but isn't there a problem? I mean, I'm just going to go on birth control pills. Shouldn't I have a period? Like, what's wrong with me? And how come I'm in my 20s and I still have acne? He said, just go on birth control pills. It'll probably help that too. So I went on them because I didn't know any better, and it made me feel sick. So I said, I don't even want to be on these. And so then I decided I'm going to go into OBGYN and I have to figure out what's wrong with me. You know how that happens so commonly?
Yeah.
And I felt very much in sync with other women and their problems because I had my own problems. And I wanted to have a baby so much. I mean, I always knew I had to be a mom. It was so important to me. And that's why also I was worried. It's like, but if you don't have a period, I'm like a medical student. I know you have to have ovulation to get pregnant. How is this supposed to work? And he just said, well, worry about it when you want to get pregnant. You're not going to get pregnant for a long time. You have to go through all your training. And it's like, I'm not going to wait. I'm not going to wait until I'm 30 to even start trying because I could be a fertility problem. So as soon as I finished my medical school, I wanted to get pregnant. I just wanted to get through medical school. I figured that was a bad time to I got married when I was in the middle of medical school. So I was all set. So as soon as I finished medical school, okay, I want to get pregnant. So I got pregnant when I was an intern. They did not like that because, you're not supposed to be bothering, the rest of the medical staff with your pregnancy. But I was so hardworking. I didn't miss a day during my entire pregnancy. I saved all my sick time and all my vacation time. So I did not take one extra day, not one extra than what I was entitled to. And I actually delivered within like 2 or 3 days of my due date. And I was out for just 6 weeks, and then I was back again. That's, so that's what I don't recommend that. But I worked almost to the day I delivered, and I did that with all my other kids as well. Somehow, I think it's mind over matter. I said, I have to go into labor on this day.
How many kids do you have?
4.
And how old are they now?
They're grown-ups. I have 5 grandkids.
Oh, wonderful.
Yeah, that range in age from 3 to 10.
Oh, that's beautiful.
And it's a joy, but none of them live really close to me. But I visit a lot, and thank goodness for FaceTime and planes, so I can go visit a lot. That's why I always identify with women who have fertility problems. I had fertility problems. I had to use fertility drugs for my first pregnancy, and then I changed everything I could change. I experimented on myself. My cycles became regular. So basically, I controlled my own PCOS, and that's why it's one of my specialties. I deal with every female problem there is, but I always have this special part of me that really is bonded to every woman who is struggling with PCOS because I did myself. And by the way, I have a book that just came out on PCOS.
Oh, excellent. What's it called?
It's called PCOS SOS, A Gynecologist's Lifeline to Naturally Restore Your Rhythms, Hormones, and Happiness.
Oh, fantastic.
So it's all about gut problems and endocrine disruptor problems and all the different things that go into creating what has become a normal, what is a normal variant of female health, which is PCOS. It's a normal variant, but it's exacerbated into something that's a disease state because of all those things that I just mentioned, circadian rhythm dysfunction and endocrine disruptors and bad diets and dysbiosis of the gut and all of that. So there's a lot we can do. There's so much we can do. And it doesn't involve birth control pills, spironolactone, or metformin.
So I was so excited when I heard about you and also to meet you because, as you said, you're an absolute rarity. Are there any other integrative gynecologists in the US?
There are some functional medicine gynecologists, and that's sort of a tricky thing. What's the difference between functional and integrative? And I consider myself both. And it's an arbitrary sort of designation, which you are. I think integrative looks at more mind-body medicine in great detail. And that, of course, is very critical, whereas functional is looking at more biological and cellular pathways. I like to put it all together.
So this is really interesting because I'm starting to learn these terms because in Australia it's a little bit different. In Australia, there are no integrative specialists. So there's quite a few integrative MDs, like people who've gone on GPs and then done their nutritional training. What led you down that pathway to look at the integrative side of things?
I've always been really involved with the integrative approach. Way back when I began my practice, I had no training in that area at all, but I knew that there was more to helping people to be healthy than simply giving pharmaceuticals and doing surgery. So from the very get-go of my practice, I incorporated a Chinese medicine practitioner, a nutritionist, I had a psychologist, I had a massage therapist, biofeedback. So I knew that I had to have a bigger toolbox. But then about a decade ago, it was my time to give up obstetrics, which I loved doing, but I just physically couldn't do it any longer because it was all nights. I was up virtually every night, and I was very bad at delegating. I took my relationship with my patients so seriously. I always wanted to be there. And so I couldn't just let go and not monitor my own patients when they were in labor. So it was either an all or nothing thing for me. So I gave up doing obstetrics about a decade ago. And probably because I had more sleep, a little bit more rested, I started demanding of all the pharmaceutical reps. And in the US here, we had a parade of pharmaceutical reps that came through my practice. And I demanded that they show me their original studies that allowed their drug to become FDA approved. And I was shocked with what I actually found. And I said, wow, this is hardly different from placebo. You just made the graph and you blew it up to show a difference. It was really not very significant. Somehow they played with the numbers, it seemed, so it made statistical significance. But in terms of actual day-to-day benefit, it seemed really low, to say the least. And when you look at the side effect profile, it seemed like, well, this is more harm than good.
What kind of drugs are we talking about here?
Things like drugs for bone health, like the bisphosphonates, things for overactive bladder. Like I would look at it and say, oh my gosh, in 24 hours, there would be one less void. So you're taking a drug that can give you dementia and constipation and feel terrible so that you go to the bathroom one time less in a day. It's like, this doesn't make any sense. It was very, very disturbing. And then I started saying, okay, well, let's take a look at all the different birth control pills. And I said, wait a minute, what have I been prescribing all these years? There's no hormones. Why do they call it hormonal contraception? It should be called the anti-hormonal contraception. And the more I did a deep dive into what I was prescribing, the more horrified I became. And I said, I basically lost my purpose. I said, I don't know what I'm doing. I'm very good at surgery. I taught surgery for over a dozen years as a clinical professor, assistant professor at USC Medical School. And so I taught a lot of residents how to do their first hysterectomy and laparoscopy. And so surgery was a big part of what I did, but I didn't want to deal with just end-stage disease. It's like, why is it that I tell patients when it gets really bad, we'll cut it out? I mean, don't we need these organs? Why are we cutting them out, willy-nilly? And we need ovaries. Why? It's like, well, you're over 40, just take out your ovaries. We're in the neighborhood. What? We don't take other organs out because we're in the neighborhood. what is that all about? So basically, I had a crisis of purpose, and I felt I was pointless. And so I had to go on my own personal journey. I started going to courses with naturopathic doctors. I had no idea who they were. I'd never heard of a naturopathic doctor, but I went to Portland where Tori Hudson was giving courses on women's health, and I went several times, and I liked the philosophy that you try to help the body to heal itself. That seemed to make a lot of sense, especially since I'd given up on most of the pharmaceuticals at that point. And one time when I was there was one doctor, Dr. Lodog, and she was giving a lecture. She was an MD, and I was an MD, and everyone else in the room was a naturopath. I went up to Dr. Lodog, and I said, Dr. Lodog, you and I are the only MDs in a room full of naturopaths, and I'm totally lost. I have no clear direction, no mentor. I'm just randomly taking classes, and I'm really lost. And she said, in 2 weeks, we start the next session for our Integrative Fellowship at the University of Arizona School of Medicine. After talking to you, I know you're qualified. Why don't you apply? So I went home that night. It was a Sunday night, and I filled out the application. And 2 weeks later, I was in Tucson, and I never looked back. It was a 2-year fellowship. So it was a combination of at the site in Tucson and also distance learning through the internet. And I did the 2-year course, and I met with all the other people in my class, and we got to know each other. And like I said, I've never looked back. I can only look forward, and I've taken many, many courses since then. And I feel I've met and got to know my tribe, other doctors like me. There are very few that are actually OBGYNs, but a lot of family doctors, internists, and then random other specialists who also are sort of outliers in every sense. And it's been a wonderful journey, and I'm so happy I went into this field now.
What was it like arriving there and meeting all these people and going, there you are, there's my tribe?
It was so overwhelmingly wonderful. We got into doing a lot of ceremonies, which I love ceremonies. And I hadn't really thought about the real meaning of it and how it can add value to your life. But we had welcoming ceremonies and, of course, goodbye ceremonies. And I just love it. It really adds so much to your life when you do these things, when you make an occasion out of something that's important. And when you do that with your new tribe, with your new family, it's so meaningful. We bonded so well, and most of us have stayed in touch. And it's really a family, an expanding family of people who did the fellowship. And it's really wonderful because we are such outliers. I'm an outlier among the outliers, but all of us are outliers. We're such a tiny percentage of all of the medical providers. And I never forget that.
Yeah, absolutely. How do you practice differently now, or what changed in the way that you dealt with people once you finished that fellowship?
Well, I changed so much in my practice. Now I actually work with 2 naturopathic doctors because I do love their philosophy, and they do a lot of work for me. They do IV nutritional therapy. They do a lot of what we call it reset. Some people call it a detox, but they do a lot of nutritional counseling and work with the patients on stress. So we work as a team. And so I love it. I still have my massage therapist, and now I've incorporated fitness into my practice. I got a new office about 5 years ago, and I have a gym. And we have like a little kitchen. So we incorporate nutrition in classes. We do fitness assessments, exercise prescriptions, which is so important. The whole area of fitness as a vital sign is neglected in the conventional medical world, even though they're told that it is a vital sign. But we actually walk the talk, and we actually incorporate fitness and nutrition. So we do lots and lots of lifestyle medicine in my practice now. I've always done some, but it's been dramatically expanded.
I have to tell you that this is just complete music to my ears, and I've literally got goosebumps because you just don't see this happening enough, yeah? And this is this collaborative care. It's that looking at the person as a whole and going, well, maybe one person doesn't have the answers. Maybe they need to have that co-management to be able to do that. Can you tell me what is the role of integrative care and making sure that patient has what they need across multiple modalities?
Well, we do a lot of testing. I feel that we really want to know what's going on. That's where the functional medicine part is really incorporated. What I do, I think, is far more evidence and science-based than what the conventional doctors do. Every time I give a lecture, which I give many lectures around the world, every slide I have is referenced by a peer-reviewed published article. So everything is very, very, very scientific and evidence-based. So I look at what's happening in the patient. I want to look at things like the makeup of their gut microbiome. I actually look at the vaginal microbiome, another forgotten microbiome by most everyone. So I look at the body from a very particular way. I look at it as us against the invaders. So we have multiple barriers. They are like our skin, even like our eyeballs, right? The female vagina, of course, the gut from the top to the bottom, starting at the mouth, and the nose all the way down to the alveoli in the lungs. So we have all these different interfaces between us and the outside world. And we have the most amazing, when things are right, the most amazing system of our barrier and our immune system to fight off these invaders that are trying to get in at every turn through all of our interfaces. But because we did not understand the key role of all these barriers, we have basically destroyed them. All of them have their own unique microbiomes. And so much of the focus is always on the gut microbiome, which of course is a huge and very important microbiome. But I look at all the microbiomes and all these barriers and the way that we have to survive in this really complex and toxic world of ours. So by not knowing about these barriers, we have placed antimicrobial soaps on our skin and who knows what in things like sunblock and topical lotions and things like that have damaged tremendously our skin microbiome. We put contact lenses with solutions and sterilizing things that are affecting the microbiomes of our eye. And of course, we all know about food. Well, at least hopefully everyone who's listening knows that someone somewhere came up with this bizarre notion that we can put poison in our food. It's so bizarre. I can't even believe that we do this, that we pour poisons on our food to kill pests, bugs and weeds, and then we eat it. Like, these are poisons. What, are we not living things? And of course, all these other bizarre things, the emulsifiers and the dyes and the flavors. So all the foods that come from factories are very bizarre. So, those are, of course, are destroying our microbiomes from our mouth down. Of course, the mouth, which I didn't learn a darn thing about in medical school, is hugely important, as we now know, in our integrative functional world. And then, of course, the nose, when people have all these allergies because their immune systems are malfunctioning, and then they take steroids and spray them up their noses, which, of course, encourages the overgrowth of fungus and all these other crazy microbes. So we have done so much harm to all of our barriers. And, of course, if we get time, we can talk about the vagina and how specific that is for female and reproductive health and how we've, without understanding what we've done to it. And that, of course, affects everything. I might have my own theories because there's so little data on it at this point, but how that really links to reproductive health and how that may actually have a lot to do with the tremendous increase in dysfunctional labors, why so many women are ending up with Csections, because the microbiomes of our uterus and our placenta are really important, and we did not know this. And even though we know this is important now, nothing's changed. Now it takes decades sometimes before science integrates into clinical practice.
Some of the concepts we explore on this program will take 17 years to make it into your doctor's office. The change needs to come from us, so I ask that you please share this knowledge. I don't care how you do it, a text, an email, a private Facebook message, or showing a friend over coffee. Let's get this information out there.
The Shift!
Can you tell me again about the microbiome and the increase in C-sections? What do we know at the moment about that?
We know, for example, that women who have preeclampsia, also known as toxemia, or gestational diabetes, preterm labor, they have very different microbial populations of their placenta. And this is brand new, really tremendous information that we need to then actually think about seriously. For example, when women take birth control pills, that we know, and this is not controversial, this is 100% accepted by the conventional medical world, birth control pills increase the incidence of cervical cancer. It allows more microbial pathogens to grow in the vagina. A lot of women on birth control pills have more vaginal yeast infections. It changes everything. The hormones not only impact the gut microbiome, they impact all our microbiomes. And birth control pills, I mentioned, are like the anti-hormones. There are no real hormones, only endocrine disruptors in birth control pills. And then what about the progestin-embedded IUDs? With the levonorgestrel and, of course, the implantables that go into the arm, none of them allow normal hormones of a woman, which definitely will change these microbiomes. And then the copper IUD, so inflammatory. We know that that also changes all these microbiomes. We know women with ovarian cancer have different ovarian microbiomes than women without ovarian cancer. So we are not thinking when we do these things as to what the long-term ramifications are. We put these IUDs and birth control pills into women, and then we stop them, and then they get pregnant because nature is so amazing. It allows women to get pregnant even when things are not right. So they very quickly will often get pregnant, but none of their microbiomes are right. And then we wonder, why are they having all these labor problems? The C-section rate is astronomical, and it's not because every single doctor doesn't care. I mean, some don't. We know that estrogen, for example, is very important for the proper function of the enteric nervous system, that amazing neurological system in the gut that controls that incredible thing called peristalsis. It's so amazing. Like, we eat food, it goes into the stomach. How the heck does the stomach know what to do? That it churns it just right, and that just the right time, it releases the food into the small intestine, which then does all the right things to allow digestion and then move it down the line into the colon. I mean, these are incredible functions. They're all messed up now. When a woman goes into labor, how amazing is that? That her uterus contracts in just the right way to have just the right expulsive forces to have the cervix dilate and then to get the baby out. It's not working right. The nervous system of the uterus is obviously malfunctioning in a comparable way to how the gut is malfunctioning with irritable bowel syndrome. And so many women have constipation or alternating with diarrhea and so on. So, of course, everything's messed up. All the microbiomes are messed up. But you don't see very many people talking about this. Why do so many women have chronic vaginitis now? And they get put on the same medications over and over. They want to pull their hair out, but no one has a clue what to do.
Can you tell me, what is vaginitis?
So whenever you hear the word itis, those letters, it just means inflammation. So a vaginitis is just an inflamed vagina. It doesn't say why it's inflamed. So it could be from a bacteria. It could be from a parasite like Trichomonas. It could be from yeast, or it could even potentially be a sterile type of inflammation, in the same way that you can have an inflammation of a joint, like arthritis, and it doesn't have to be a septic arthritis. It could be a non-bacterial inflammatory state. And all of these things can be happening in a woman in her vagina when her microbiome has been altered. There's new papers that just came out, new data, which is really horrifying, that no, you can't win now. I mean, we poor women can't win. So if a woman uses pads, they found that most of the pads, but they actually did not release the names. And there were variations with the toxins, but huge amounts of phthalates and other chemicals that act as endocrine disruptors. And of course, tremendously damaging to the vaginal microbiome. These are getting absorbed into the women's genital skin and up into the vagina when they use pads. And it's really a tremendous problem. A lot of people say, well, they can use the menstrual cup. Guess what? They have not been shown to be better as far as reducing vaginitis from bacteria. So that's not turning out to be like the savior of women. It's really a problem. It's hard to know what to do. I recommend organic tampons made out of cotton, but that's not perfect for every woman. We have to make compromises because now it's been shown that when you put in organic cotton up into the vagina, it actually brings in a lot of air. And when you put air into the top of the vagina, it can grow. The top of the vagina is supposed to be anaerobic. That means it does not grow bacteria that can survive in air, in oxygen. But when you put in a tampon made out of cotton in particular, and it goes up into the top of the vagina, it brings with it a lot of air, an environment that is abnormal. So what happens is you can now overgrow aerobic bacteria in an area with blood, which of course is a great medium for growing bacteria. They grow bacteria on blood agar, right? That's a medium for growing bacteria. So now we have oxygen. So the aerobic bacteria like Staph aureus, which is very common in the vagina, can overgrow. So it actually causes an overgrowth of Staph aureus, and here you're using something organic. So it's like, what are we supposed to do? Probably the best thing, but who's going to do it, would be to wear like organic cotton diapers. But I don't know that too many women in this day and age would settle for that. So we have to make compromises. Use, say, organic cotton, but recognize that you are increasing your risk of growing staph.
Or what about organic cotton pads then?
That would be great. That would be like the equivalent and better than a diaper, right? So if you can get, and they do make them, they're out there. Yeah. It's just people don't like it, But if you're having fertility problems, if you're having chronic vaginal problems, inflammations and infections, maybe you have to do what you don't want to do. Sometimes that's what life is about.
Tell me again about the link between the oral contraceptive pill and cervical cancer, because what puzzles me is if this is the case, why aren't we educating women on using alternative methods of contraception rather than getting them to have like the cervical cancer vaccine? And so what I want to know is, what is your opinion on the whole cervical cancer debate and also HPV even as a virus, and can the body just clear it itself anyway?
Well, HPV, human papillomavirus, has been around probably since the beginning of time. Certainly, it's been around for a very long time. The problem that's happening and why this is a growing issue is because women's immune systems are altered and the vaginal microbiome is altered. So it's not a controversial issue that birth control pills increase the incidence of cervical cancer. There are two cancers that are proven, and no one denies it, even in the conventional medical world, that are increased by the use of oral contraceptives. And those are breast cancer and cervical cancer. Now, the conventional medical world says that it lowers the risk of ovarian cancer. But when I actually looked at it and I look at the mechanism, that makes absolutely no sense. And there was one study that was out of Harvard School of Public Health that said that that's not correct. When I went back and looked at all the research on that, nothing seemed even slightly definitive at all. And it makes no sense because you have an oxidative stress environment. So that's what's causing these other cancers. So when you have inflammation and it's chronic, that's how you can get DNA breakage. So when you have an environment in the vagina where there's a chronic low level of inflammation, and then you have a virus that's been around since the beginning of time, and it's inhabited women's vaginas and onto the cervix probably since the beginning of time. But now you have a totally different world in there. You have chronic inflammation. And the normal immune system is not working because we know that women's immune systems are really altered for so many different reasons. Chronic antibiotic use, probably nowadays, lots of immunizations that can impact the development of the immune system. So we have chronic inflammation, we have abnormal hormones, And now we have a chronic infection. So we know that a very high percentage of women in the past would have HPV. But like you mentioned, they clear it. Their immune systems win. But more and more now, the immune systems are not winning, and these are becoming long-term chronic infections. And when you have constant inflammation, that's the perfect environment for cancer. So it's really the perfect storm for women to develop cancer. But most of them don't, fortunately. Cervical cancer is still one of the really rare cancers when you look at all the different cancers out there. So what women are developing, though, rampantly are the earlier stages.
Tell me about the vaginal microbiome.
Well, we're really trying to learn more about it. And it is one of the incredible complex microbiomes of the body. It has not been appreciated by gynecologists or pretty much anyone. So once again, I mean, we have more awareness now, at least in the functional medicine community, of the importance of having a healthy gut microbiome. And that's really invading, if you can call it that, even the conventional medical world. That's why the sales of probiotics, for better or for worse, is in the billions of dollars now, because people are realizing there's an importance to having a healthy gut microbiome. But the poor vaginal microbiome, which is incredibly complex, as I mentioned, the top part of the vagina is anaerobic. The bottom part is aerobic. It's fascinating. And these microbes, like all microbes, are doing all kinds of jobs to create health. And when you don't have the right hormones, and then you add in, who knows what, when the people put in tampons and spermicides, and a lot of women do use douches and so-called feminine hygiene products for freshness, whatever that is, right? I want to be fresh. I think I want to be poisoned. They don't know. They assume if somebody's selling it, it can't really be bad for you. And it says it's going to make you fresh, and smell good. So they use these things and they tremendously alter the microbiome. And now we have another big problem. It's called men. So men have unbelievable stuff growing in their semen, and they can transmit these things. And they're not called sexually transmitted disease, although, of course, some of them are, like chlamydia and gonorrhea. But a male can be the host to all kinds of viruses and microbes that are in the semen. And then when they have intercourse, those things, those different microbial forms of life are put into the female vagina. And that's why women typically don't get bacterial vaginosis, where you get this really altered microbiome with this like infectious kind of a state, until they start having intercourse. And, men will often have multiple partners. It's considered normal now for people to have lots of sexual partners, and they get things picked up from women, and then they give it to the next woman, who then harbors it, who gives it to the next man. And these create terrible scenarios of these inflammatory states and altered microbiomes, which then can translate once again into fertility problems, male fertility. They're actually now starting for the first time to look at what's really growing in male semen and how that translates into male infertility.
It's an important conversation because we're talking about reproductive health. We're talking about the health of the penis, the health of the semen, the vagina, but it's related to our gut ultimately, isn't it?
Well, actually it is. That's very true, because when people poop, it's not an accident. When I first started doing obstetrics, it was, oh my gosh, the baby's head, when it comes out the vagina, turns down so that the mouth of the baby, unless it's upside down, which it's not supposed to be, that's abnormal, right? When you have the upside down baby's head, the mouth of the baby is right next to the anus of the mom. And it was, oh my gosh, that's so dirty. So when I first was doing obstetrics, they would take betadine, that's, the iodine cleaning solution, and they would wash off the woman. We want to get rid of all those bacteria. So, they want to get rid of everything they can possibly get rid of, sterilize the mom. And it's like, this wasn't an accident. Nature is perfect. Nature designed everything just as it should be. We used to clean out the vagina. We don't want that dirty stuff getting on the baby. Oh my God. When we give women enemas so that they would never poop, because, oh my gosh, you don't want to have when you do Valsalva and you're trying to get the baby out, you might have poop come out. Oh my gosh, what if the poop got on the baby? How terrible, it can't happen. So we did everything wrong. But of course, it turns out that the microbial population from the gut is important in all kinds of ways regarding the vaginal microbiome. And the vaginal microbiome is designed to specifically incorporate and also to repel. It's like a beautiful, perfect scenario. So when you have a healthy vaginal microbiome, for example, E. coli, which is the most common cause of bladder infections, and there's a lot of E. coli in the colon, but a healthy vaginal microbiome is totally capable of preventing E. coli from coming out with that comes out with the poop from getting up into the bladder. Now, who gets a lot of bladder infections? Women on birth control pills. Oh my gosh. And I have seen so many young women who've been on so many courses of antibiotics, it just makes me want to cry. And they've been on birth control pills since they were like 14, 15, sometimes even younger, because they had bad periods, which is another whole thing. Because so much is wrong these days, the average girl has terrible cramps and irregular or heavy periods. So instantly, they're put on birth control pills when they're incredibly young. And then when they hit around 20, in that neighborhood, sometimes younger, they start having bladder infection after bladder infection. So no one is thinking, oh, well, maybe you have the wrong vaginal microbiome. The vagina is the guardian of the bladder. So it cannot guard the bladder. And so bladder infections are rampant, and they put them on course after course of antibiotic. Well, meanwhile, they're still on birth control pills. And it's just a horrifying scenario because now they're destroying the gut microbiome along with the vaginal microbiome, which is already damaged by the birth control pills as well. The other group, of course, that has a lot of bladder infections are postmenopausal women, because they don't make estrogen. So you have these two populations of women on birth control pills and similars, and then postmenopausal women who are having rampant urinary tract infections. Well, we know how to try to give hormones to try to balance the vaginal microbiome in women who are in menopause, but what we're doing is so iatrogenic. It's so completely caused by the medical world to damage these women. And it just goes on from there, because then a lot of them have the pregnancy-related complications that we talked about. They have the wrong microbiomes of everything in their fallopian tubes, their uterus, their placenta, everything. Everything is going wrong.
Want to look deeper into your own health? Our virtual naturopathic team help people from all over the world to shift their health and their life. We offer a 90-minute online discovery and diagnostic session where you can find out where you're at, why you're here, and what you need to do about it. Everyone is so unique, and sometimes it can help to have someone break down your journey and see where it is that you need to head next. To find out more, go to theshiftclinic.com and click on Shift with Us.
So tell me about then Strep B in pregnancy, if that shows up, and the use of antibiotics during childbirth.
So Strep B is considered a normal variant of bacteria in the vagina, and there's been so little research as to who gets it and why. My own theory is it's probably in very large measure related to birth control pills and tampons and other things that have altered the microbiome to allow it to overgrow. But once you have it, now we're stuck. Because although it's rare, it can be fatal to the baby. So we're in a no-win situation. Once you have it, I can't say, well, ignore it. Because what if your baby is that one that, and I've had it when I did all those thousands of deliveries for 25 years, I actually can recall one patient whose baby had group B strep, and it goes way back before we screened for it, because we weren't always screening for it. It went way back, and the baby got group B beta strep, and for whatever reason, it overwhelmed that baby, and that baby died. I never forgot that. It happened in less than 24 hours. That's how aggressive it was. So I wouldn't tell anyone, if you actually have group B beta strep, not to be treated with the antibiotics. But it breaks my heart that this is even happening.
So it's really looking at, it's all coming back down to microbiome and improving the health of the gut microbiome, but also the vaginal microbiome. How does the microbiome change throughout pregnancy and leading up to birth?
Wonderful question, and we don't really know. So that's how little research there really is. It's really very much an incipient field, but of course it's going to change. If we talk about the gut microbiome, it's a fascinating story. And there's been very little. We need to do studies on the transformation of the vaginal microbiome. We do know at the end, for example, the last month of pregnancy, there's a tremendous increase in growth of various strains of lactobacillus. So in the last month, but exactly the very last month before delivery, the vaginal microbiome is definitely changing. But what happens on a month-to-month or even trimester basis, we don't have a lot of data on that yet. But we know it's changing.
It's going to be really interesting, isn't it?
I can't wait to get some research. But we know that the gut microbiome changes immediately with pregnancy. And this is really fascinating. So if you think about women who are pregnant, what's one thing you can say? They gain weight. That is nature's need. It needs to put weight on women who are pregnant. They need to store fat so that when they have their babies, they have their reservoir of energy to create breast milk and then carry through, like if it's a cold winter with little food. So if you think back in time, like in the story, the Disney story, Bambi, all the animals were born in the spring. Human babies were also born in the spring. Everything's different now. People are born any time of month. Of course, they always could be, but there was a definite preponderance for babies being born in the spring. And that's nature's way. Men's testosterone is seasonal. Men have more testosterone when they would conceive a baby with their partner to create a delivery in the spring. Their testosterone is different when it would be a winter delivery, because if a baby is born in the dead of winter, there would be a lower survival because of the food source. So most babies would be born in the spring, and moms would get a lot of body fat, and then they could gain a lot of weight during the summer and then get through the winter. So as soon as women become pregnant, their gut microbiome changes. It becomes inflammatory. And you think, what? Why would their gut microbiome become dysbiotic, like abnormal and inflammatory? And then women who are pregnant get leaky gut. And you think, why is that? Because inflammation creates insulin resistance. Now, we don't want this when you're not pregnant. You don't want to be insulin resistant, right? And we know that's prevalent. Diabetes in the U.S. is ridiculously common. And of course, prediabetes, they say, is like 50% of people now. It's that crazy. So, but in pregnancy, most obstetricians know this, and a lot of women know this. You're more likely to get what they call gestational diabetes. Gestational meaning, of course, during pregnancy. Now, why would women get more diabetes when they're pregnant than when they're not pregnant? Because of the gut microbiome. This is like one of the most fascinating things, because we've known forever, it seems like, from the very beginning when I was in training, that women are more prone to diabetes in pregnancy. And then it would clear up after they had their babies. And then now we know, we didn't really talk about it then, but those women are more prone to having metabolic disorders like diabetes throughout their life, and then particularly after menopause. So, but what is it about pregnancy, and why would nature do that? Because when you have a dysbiotic, abnormal, not in pregnancy, but for what it would be for non-pregnant state, we have a dysbiotic, meaning it would be abnormal growth of bacteria in the gut, and you get leaky gut, and you have inflammation. Once again, like I said, you get insulin resistance. When you have insulin resistance, you have elevated insulin. When you have elevated insulin, you get fat deposition and storage. That's the problem for diabetics. They can't lose weight. If you have high insulin, you cannot lose weight, because insulin, by its very intrinsic nature, causes fat to be stored and fat to be made. And that's why you've got to get that insulin down if you want to lose weight. Well, in nature, they want you to gain weight when you're pregnant. That's why women can gain weight when they're pregnant, even if they don't eat anything more. And that's why we now understand that getting fat doesn't necessarily have as much to do with eating as what we used to think. Of course, it does have to do with what you eat. But if you are eating toxins, that are now like what they put in our food, right? You can get a dysbiotic gut creating insulin resistance and high insulin and weight gain, even when you're trying to eat healthy food. But the healthy food, for example, is coated in glyphosate. You can gain weight. And of course, we call those things now like diabesogens. Well, pregnancy naturally is a diabetic promoting state. So it's really fascinating how nature changes the immune system. The immune system of a pregnant woman is so unique and different from any other state in a woman's life. And the gut automatically changes to encourage leaky gut when you're pregnant, inflammation, and high levels of insulin promoting fat. So it's really fascinating. But when it goes to the extreme, when things are already, like we'll say, in a tenuous state, then you go over the edge. And that's when you get diabetes, gestational diabetes.
What do you think about cesarean sections then and their impact on the baby's health? And also, what do you think people can do about it?
Well, the incidence of C-sections is just enormous. We've never had levels like we have now.
What is it in the US at the moment?
Well, it varies from hospital to hospital. Some hospitals have as high as 50%. Some of them are like 30%. It was in the single digits at one point, and now, a really good level is considered to be in the low 20-something% range. It's really the norm in many hospitals now. So it's not all the obstetrician's fault. That's why I want to say, in some cases, yes, they're too aggressive, they break bag of water or they start Pitocin when it's not indicated. And so there can be overmanagement, which leads to problems. But because, like I said, the microbiome of the placenta, the uterus, and so on, they're altered, a lot of women don't even go into labor. What is wrong with them? How come they're going 2 weeks overdue? It's the whole system is malfunctioning. It's just malfunctioning. So we have epigenetic modification of babies because of the health of the moms and even the health of their moms. So everything is different. We have really high numbers of very large babies and the macrosomia, which is large babies, that's really becoming also epidemic. So there's a whole bunch of reasons. I think more babies are maybe in malpositions as well. And now everyone with a breech in the U.S. gets a C-section. So there's a whole slew of reasons why the C-section rate has really increased. And of course, it's not great for the mom, because she's having a significant surgery. But for the baby, it's really putting one strike against them. Right from the minute they're born, they have a strike against them because they've lost the vaginal lactobacillus. Of course, the crazy stuff was when I first started doing obstetrics, they would wash out the vagina, they'd wash everything off. So I don't know how much good even having a vaginal delivery did for anybody at that point, right? It was crazy. And then we take the baby and immediately wash the baby in some kind of antiseptic. We did such crazy stuff. I'm like embarrassed to even think about it, that this is what people were doing to a natural process. They were wiping everything down, cleaning because we want to make it sterile. It was because bacteria are evil, that whole philosophy. But left to a natural state, having a vaginal delivery is so important for getting the microbiomes of the body. Remember, it's all the microbiomes. Of course, we focused a lot on the gut, but what about the skin microbiome, the vaginal microbiome? All the microbiomes of the body get a good start when they go through a healthy female vagina. Of course, what about the unhealthy female vagina? Well, that's what we have nowadays. So even a vaginal delivery doesn't necessarily mean you got the best start. It's better than a C-section. But what about the woman who's growing weird stuff, in her vagina? It's still problematic.
Dr. Felice had so much to share that I just couldn't cut out enough for just one episode. This conversation will be continued in part 2, where Felice shares more about a woman's unique health picture, as well as a very personal story that shaped who she is today. Plus, I'll give you my takeaways and tips as a result of this conversation.
Coming up on The Shift.
What do you think the role of the microbiome and gut health is on reproductive health and fertility?
Well, it is very significant, like all the microbiomes are. But if we look at the gut microbiome, we know that there's a huge communication between the gut microbiome, the brain, and even the ovary. So there is a relationship to everything.
I hope you're loving the information in The Shift as much as I do. But maybe you're thinking, what do I need to do for me? Take our online assessment to discover what your gut is up to. Go to theshiftclinic.com/quiz.